I'm talking to acupuncturist Sharon Kastoriano today. Hi Sharon, how are you?
I'm great, thanks. Hi, Joanne.
Sharon, with regards to acupuncture, is it a new age treatment? And why is acupuncture successful as a treatment?
It's not a new age treatment. It gets labeled as a new age treatment because it's relatively new to the West since the 1970s. But I mean, its history goes back thousands of years in China and Asia, and there, it's been used for that length of time. Why is it successful? I think that well, it depends on what you're treating it for, but it's extremely successful for sort of these long-term chronic issues that Western medicine doesn't seem to know exactly how to treat, or maybe only has medication to treat. We have lots of other tools to help people.
Can you give me some specific conditions that a person could come to you for treatment for?
I mean, all kinds of things, but the most popular things that have got the most sort of media and attention are, for example, pain, which could be any type of pain, whether it's, back pain, knee pain, neck pain. It's very, very successful for treating that. And like if somebody goes to the doctor, really their only option is to give them pain medication. So acupuncture can really help to lessen the pain and, even get rid of it. Other things aside from pain, lots of like digestive issues. If fertility is now, there's more and more research being done to show acupuncture can help improve fertility. Allergies, asthma, a whole range of things. I would say if somebody has a health issue that they feel is not being well treated with, either medication, to give acupuncture a try.
How does acupuncture work?
Well, we can explain it from a couple of ways. From the sort of the Chinese medicine philosophy, there's this idea that there are channels of energy that cover the whole body, and you are looking to find where there's a blockage, for example, in one of these channels, and you needle on certain points. You choose certain points on these channels on the body. They're all over the body, but typically we're choosing points on the arms, the legs, and you're regulating this flow of energy. From Western terms, it's like we're improving blood flow, improving circulation. Then this can help with with hormones and help to regulate systems, and that's how we're improving health. There's more and more research being done because as it's becoming more popular in the West, the science is like, well, how does it work? So they're doing lots and lots of tests to sort of figure it out. But as yet, no clear answer.
I think probably one of the first thing people think about when they think of acupuncture is the needles. Is the treatment painful?
Absolutely not. I wish we could call it something else, because you say needles and then people automatically think of doctors and getting shots or immunizations. And I can't tell you how many times I hear people go, oh, I'd love to try acupuncture, but I hate needles. Maybe if we called them pins or something like that, because they're so tiny, like if you were to see them, they're just sort of not much bigger than a human hair. And they're very gentle. And most people, as the needle goes in, maybe you feel something like a mosquito bite or something like that. But sometimes you don't even feel anything. And afterwards, you feel like very relaxed. People are always amazed that they can feel that relaxed from acupuncture, from needles.
And how many sessions does a person normally need?
It really depends. It depends on the condition, depends on how long they've had it. Say if somebody has just pulled their back, they're in pain from back pain, one session, maybe 2 sessions can fix the problem. But if it's something that somebody, a condition that they've had for a long time, for years, then they're going to need, a number of sessions. It could be, weeks, it could be months. It really also depends on how, that individual responds to treatment.
I've heard people say that acupuncture is holistic. What do they mean when they say that?
It means that we're looking at the whole person, the whole body. So we're looking at, if somebody comes into me and says that they have a headache, I'm not just looking at the headache. I'm going to look at, a whole range of things, from sort of simple things to like where on the head is the headache, because there's a difference for us in terms of treatment if the headache is here as opposed to here in the back of the head. Also, when they get the headaches, for women, if it's, related to their menstrual cycle, that plays a role. Then we're looking at also diet, lifestyle, other factors, stress, work, all of these things come into play, and that is how we're going to treat so we're not treating the headache, we're looking at, we're treating the person to fix the headache.
And Sharon, in what cases would acupuncture be inadvisable?
Well, I mean, in emergency situations, for example, if somebody, called me and said, Sharon, I have some chest pain, can acupuncture help? I would say, immediately you should call the ambulance and you should go to the hospital and get checked out, And then here actually is where, like a good example of how acupuncture could play a role. Okay, so somebody goes to the hospital with chest pain, if it's a heart attack, Western medicine is amazing for treating that, and that's where, so that's the best place for them. However, people sometimes go with chest pain to the hospital. The doctors say, you know what, we don't see anything. It looks like maybe it's an anxiety attack. But there's nothing that they can help them with. They say, maybe I'll go get some therapy or something like that. So that is when that would be a really good time for somebody to come for acupuncture, because that's what we can work on, that stress and anxiety that's causing that pain.
Thank you, Sharon. Thank you so much for talking to me today.
You're welcome. Thank you, Joanne. Bye-bye.